historically, people have thought that the brain was immune privilege. And what that means is that the peripheral immune system doesn't interact with the brain. However, over the past 40 years, it's been pretty clearly shown that the immune system can and does invade into the brain and has a huge effect on everyday behavior, activities, etc. When I was a graduate student, one of the first experiments that we did was looking at how some resident immune cells in the brain were really important for inflammation and other things. And it turned out that other cells within the peripheral immune system, were recruited into the brain, and that is the definition of immune compromised. So historically, neuroimmunology, or the study of how the nervous system and immune system interact, has been kind of balanced with how the peripheral blood can interact at the blood-brain barrier. And it turns out that the blood-brain barrier can be leaky, meaning blood cells can get from the peripheral blood into the brain. The blood-brain barrier actually has cells that you can travel from the blood into the brain, but also they can release factors, and these factors, which aren't directly immune cells, they activate immune cells on the other side within the brain, and that causes immune activity. And this happens at kind of different levels. It can happen in the brain, it can happen in the spinal cord, and when it happens in the brain, you see effects like depression, anxiety, cognitive deficits, and if it happens in somewhere like the spinal cord, you see maybe pain, motor deficits, etc. There's another huge thing I want to talk about actually. So there's a nerve in the periphery called the vagus nerve, and the vagus nerve here at UTD, we're really known for individuals that work throughout it, stimulating it to help in various effects, various things like stroke, hearing loss, etc. However, within the context of neuroimmunity, the peripheral nervous system can be activated, and the vagus nerve itself can take a signal from your gut and bring it up into the brain and cause inflammation that way. So not just through blood-brain barrier or blood, but actual nerve impulses can bring and activate the immune system into the brain.